Good afternoon and welcome to the July Affiliate Webinar. Thank you very much for joining us this afternoon. My name is Beverly Black and I'm the Director of the Affiliate Relations Division at ASHP. I'm joined by several staff members and representatives from 4 of our state affiliates. The title of today's presentation is Optimizing the Practice Advancement Initiative, or PAI as we fondly call it, at the state level. As you know, the Pharmacy Practice Advancement Initiative, or PAI, is focused on transforming the practice of pharmacy to enhance the role of pharmacists in providing direct patient services. The initiative is a great way to help a state or an institution analyze gaps and establish priorities for practice advancement in their state or institution. But how do you get started with the initiative? This webinar will include an ASHP staff member and 4 state affiliate representatives to identify how to best leverage the tools available and offer creative ideas on how they achieve success. Each of these state affiliates used a grant from the ASHP Foundation to start their PAI development process. And one of the speakers will outline how, and each of the speakers will outline how their state organization applied for and received a grant, and we'll talk a bit about how you might be able to do the same thing. Our presenters are as follows: Eric Moroyka, Director, Center on Pharmacy Practice Advancement, ASHP. Jacqueline Boyle, representing the state of Ohio, Assistant Professor in the Department of Pharmacy Practice at the Northeast Ohio Medical University, NeoMed College of Pharmacy. She also has a pharmacy practice site at Northeast Ohio Medical University. Robert Osteen, Clinical Pharmacist of Surgery Services with a focus on neurology and neurosurgery at the Oregon Health and Science University. Denise Fields, representing Indiana, a clinical consultant at Humans LiveWell Center in Columbus, Indiana. And Kathy Baldwin, representing Florida, who's a clinical pharmacy practitioner in critical care at Baptist South in Jacksonville, Florida. A couple of housekeeping announcements before we begin. To avoid background noise, each of you has been placed on mute. So if you have any questions during the presentation, please put them in the question box or the chat box over on the right-hand column on your screen. We'll cover all of the questions at the end. So without any further ado, I'll turn it over to Eric Moroyka.
Thank you, Beverly. I'm Eric Moroyka from ASHP, and I'll get started with my portion of the presentation. First of all, just briefly, some origins of the Practice Advancement Initiative. The Pharmacy Practice Model Initiative and subsequent ambulatory care summits brought together many pharmacy thought leaders and experienced practitioners who came to consensus on practice advancement opportunities and recommendations. These recommendations are published in our journal, AJHP, and are found online on the PAI website or via the AJHP website as well. These summits sought to significantly advance patient care by developing and disseminating futuristic practice recommendations that support pharmacists' roles as direct patient care providers. The resulting PPMI and subsequent Ambulatory Care Summit, now collectively known as the Practice Advancement Initiative, or PAI, have become a far-reaching national movement that has sparked exciting patient care improvements in health systems, hospitals, ambulatory care settings, and other sites of care. The foundation for these summits built upon the successes of previous consensus development conferences, such as the Hilton Head Conference and the Pharmacy in the 21st Century Conference. In 2015, ASHP rebranded from PPMI to the Practice Advancement Initiative. Seen before you are the pillars of PAI. PAI is focused on transforming the practice of pharmacy to enhance the role of the pharmacist in providing direct patient care services, i.e., supporting the pharmacist's roles as direct patient care providers. This graphic describes the focus of PAI, what it is, the 5 goals or pillars of PAI, and examples of the recommendation for each one of these goals. Regarding the PAI self-assessments, these are based on the summit recommendations and align with the 5 pillars. Ways to engage alignment with PAI recommendations and to monitor progress are through the use of the PAI hospital and or ambulatory care self-assessment tools and their corresponding action plans. The self-assessments are a no-cost concrete engagement mechanism to help an individual practitioner or state analyze practice gaps and establish focused priorities for improvement. Many sites have found unique ways of leveraging these assessments on a recurring basis as a foundation for strategic planning or focused goal setting. The assessment completion rates, foundation PIA grant submission opportunities, and holding a PAI state affiliate workshop are all potential platform deliverables for a state affiliate presidential term. The video here, it's less than, we're not going to show this, but it's less than 2 minutes, and I encourage you to look at it. It just briefly goes over the PAI pillars, the self-assessments, how to engage them, and then the subsequent action plan. Based on some of those action plans, you result in action list items. These are a sampling of the top priority action list items that members have gone on and completed for both hospital or ambulatory care self-assessments. I'm not going to go through each one of these, but just a sampling of them are assigning initiation of medication histories to appropriately trained pharmacy technicians, encouraging growing a staff of residency-trained pharmacists, billing for the provision of ambulatory care pharmacist patient care services. As far as our learners, so these are our student pharmacists and residents. State affiliates and practice sites who partner with schools and colleges of pharmacy have found value in leveraging to help advance PAI efforts and awareness. Use of the PAI self-assessments and action plan development can facilitate important discussions with student pharmacists and resident learners, helping to prepare the next generation of pharmacy professionals in the context of practice advancement. So there's been several articles published recently in AJHP on layered learning models in different settings, also expanding service with a net neutral effect on FTEs. So really using them as part of and integrating them as part of your staff to sustain and advance practice. We also have case studies, spotlights, and toolkits. The ASHP section and forum members, essentially the engine of ASHP, have continued to be active participants in supporting PAI. A number of resource centers have been developed that target PAI priorities. One most notably is billing and reimbursement materials with the section of ambulatory care practitioners. Additional resources can be found on ASHP Connect, educational programming at ASHP meetings, practice spotlights, case studies, toolkits, the PAI affiliate grant workshops, and a plethora of articles published in AJHP. Regarding the state affiliate workshop grants, this is from the ASHP Research and Education Foundation. Workshop must be focused on advancing patient care and pharmacy practice. We have funding for approximately 6 grants for the upcoming fiscal year. The grant, although it's $2,000 seed grant, is probably closer to $4,000 if you account for the paid workshop facilitator who is assigned by the ASHP Foundation. Your program must include a statewide plan. It's very simple to fill out. It's an online. It's not an exhaustive grant application. The grant provides the workshop leader. And for example, Wisconsin developed a Tech Check Tech toolkit using a state task force, including residents and students. The toolkit has a sample letter to the Board of Pharmacy, a sample policy and procedure, and a sample training program that can be used and fit for the appropriate site that you work at. So this is just a sampling of the PAI state affiliate grants to date. 21 have been awarded, 5 states have been awarded 2, and 6 in total were awarded in 2016. As far as grant success stories, those states that have sought PAI grants and held focus summits have demonstrated the best survey completion rates. They have established clear practice advancement priorities and have successfully advocated for expanded pharmacist scopes of practice. So there's an example of a few of these success stories. One, I believe this was Indiana, education and training on current reimbursement practices and options for pharmacists to create financially sustainable services. We've also had, which I mentioned from Wisconsin, the Tech Check Tech Toolkit. And there's also been toolkits based on transitions to care developed as well. On our PAI website, we do have an infographic to our progress measures. These are based on select recommendations from the self-assessments that we have highlighted there, and additionally, there are comparators by year. As far as key takeaways, would encourage you to develop an outreach strategy to complete the assessments and use the action list to develop specific actions for your state. You can tie these priorities to your organization for foundational strategic planning. You can also connect these activities to advocacy efforts, engage your learners, reach out to those states who will subsequently follow my presentation here, who have had success. Submit case studies or spotlights on small wins. One example of this might be last year I visited at Yale New Haven. They have a nice committee structure engaging learners and staff on practice advancement. I mean, something as it's a win. It can be published and shared with the rest of our membership. So that concludes my portion of the presentation. Thank you for your time today, and now I'll be followed by Dr. Jackie Boyle, who will speak to you about the Ohio affiliate's efforts with PAI.
Hi, thank you, Eric, and thank you all for tuning in today. As Eric mentioned, my name is Jackie Boyle, and I'm the current president of the Ohio Society. I also am past chair of our Practice Advancement Initiative steering group here in Ohio. I'm really excited to share our story with you. I hope that it sparks some ideas or interests within your affiliate. And really my key takeaway, which I'll talk about a few times, is just to start somewhere with practice advancement. So I wanted to outline just a little bit about what we've done in Ohio and show you that our journey has not been overnight. It's definitely been a multi-year effort. So many of our activities have aligned very well with ASHP activities, and in some ways we've branched off and made that into our own Ohio-specific needs. So as you can see, in 2010, PPMI was published, as Eric had mentioned. In 2011 and 2012 is really when we started to organize a steering group at the state level and started focusing on completion of the hospital self-assessment. We did also have one of our members create a Ohio-specific PAI dashboard, which really helped us focus on highly feasible and high-priority items within our state. In 2013, we applied for our first state affiliate workshop grant, and we're lucky enough to receive it. What we used that grant funding for was to reach out to our small and rural hospitals, because we heard from our members that a lot of members who were part of the organization could not always make it to our state meetings because oftentimes they weren't able to leave the pharmacy, or literally they were the only pharmacist there. So we wanted to take our show on the road, and we were able to use that grant funding to bring practice advancement to small and rural hospitals in that way. Following the Ambulatory Care Summit in 2014 at the ASHP level, we realized that we needed to refocus our efforts and start to put more investment into growing our ambulatory care projects and also support for our membership, as we've also seen many of our members shifting into more outpatient settings or growing those services as well. So because we are not an umbrella organization in Ohio, we were hoping to collaborate with our two other state pharmacy organizations, and with help of another ASHP Foundation grant, we were able to put on the Ohio Ambulatory Care Summit in collaboration with these two organizations. For 2017, I'll talk a little bit about our priorities moving forward, but at the moment we are working on increasing our ambulatory care self-assessment rates and have actually established a statewide ambulatory care task force. So as I mentioned, we do have a PAI steering group. You'll see here we have 17 members, but it is comprised of pharmacists, pharmacy technicians, residents, and a student pharmacist as well, which we are adding this year. We do have a co-chair structure, which seems to work out really well. We have new incoming co-chairs, one being a new practitioner and the other a pharmacy technician for this year. This group works on making recommendations to the standing committees or divisions of the state affiliate, other board members, and our executive board for consideration. And usually they will meet quarterly. 2 of their meetings happen via teleconference, and 2 of them are in person. So usually, although they do make recommendations to the rest of the organization, we find that members of the steering group will often lead PAI-related projects or organize sessions for our membership that are put on at our annual meeting. So I wanted to touch briefly on the application process, just so you know a little bit more about it, and I think others will contribute to this conversation as well. But we found in Ohio that applying for this grant is fairly easy as long as you follow the instructions. So if you see the online application, just make sure that it's complete. You will need a cover letter and 3 letters of support from 3 affiliate leaders, at least 3 affiliate leaders. The nice thing is that there's no deadline for this application. So if you have an idea and it comes about in the middle of the year, it's perfect time to start submitting your application. So in our last application process, we identified that ambulatory care was a need. So we collaborated with the board of the state affiliate, retrieved the letters that were necessary, and just to let you know, our turnaround time was only about 4 weeks. So the turnaround is really quick. If you're thinking of planning something for later this year, it's definitely not too late to get that grant submission in. Some key things that we've learned from this is that funding can really help for your idea to become reality. So don't be afraid of applying for these grants. ASHP is extremely helpful throughout the process. And if you are not an umbrella organization, working with other state organizations can allow you, one, not only to pool your funding, but also to pool resources as far as human resources goes. One thing we realized in Ohio, too, that practice advancement will always be a priority. So while this steering group was appointed kind of on an ad hoc basis, is likely to remain as a standing committee going forward. I believe that as you collaborate with ASHP and receive this grant funding, your membership will see the connectivity between the 2 organizations and notice that your parent organization is supporting you well. And then, like I said, you can get new ideas that come about from establishing new events or initiatives with grant funding. So I'd really encourage you to think about taking that on. So where we stand today in Ohio, we have a couple of top priorities, which I think you'll hear are priorities for most of us. Provider status at the state level being number 1 on our list. We're also looking at credentialing and privileging in outpatient setting, and our steering group is working on a toolkit put together for our whole membership to have access to. We'd really like to start incorporating the pharmacy forecast into our programming and projects as we look forward into the future of pharmacy. Ohio, unfortunately, is in the top 4 in the U.S. for opioid overdoses, so that has become a high priority for us. And then as you can see, our ambulatory care conference was received with such high praise that we will actually be establishing this program as an every other year event. Residency expansion is on our task list in Ohio as well, and so our group has suggested that the RPDC program be brought to Ohio every other year, which has been done, will be conducted, the second one, this fall in 2017. And then lastly, of course, technician advancement is important, and we have established a standing committee or division within our state affiliate and also focus on placing pharmacy technicians in prominent leadership roles and within project work within the state affiliate. So I hope you took away a few things from what we've done here in Ohio and things that we've learned. Myself and Sarah Foos are the outgoing co-chairs of the Practice Advancement Initiative group, but we still sit on the group, so we'd be happy to help. And then Christy and Keith, who are their contact information is listed here, are the incoming chairs. So if you'd like to reach out to any of us, we'd be happy to discuss any of our initiatives with you further.
All right, now we're going to hear from Robert Osteen from Oregon.
All right. Hi, everybody. Thanks for coming. I'm Robert Osteen. I'm from Oregon, the other OSHP, just to confuse you. Let's not and today I was going to just go through a little bit about our planning for how we use the grant money to actually form a PAI summit in order to get this kicked off in our state. So initially we started looking at PPMI about 3 years ago, right before it changed to PAI. And in order to get going with it, we developed a leadership task force to figure out where we were and what we needed to do. And this leadership task force consisted of about 5 to 10 members, kind of flexed variously based on who was available. Initially, we mainly just had members of our OSHP board as well as some hospital institution leaders, but we realized we needed to broaden that out to get a more diverse focus. So we also invited some members from the schools of pharmacies as well as some residents and students to help us to get their perspectives too. Once we got going with that, we started to apply for the grant. And so one of the things that was spoken about by Jackie was that, you need your letters of support to help with this grant. So we actually reached out to our the president at the time and the previous past president as 2 of our letters, as well as we used a few people on that task force to get those letters. A couple of the big challenges we were having with the PAI initiative in Oregon is we're a fairly large geographic state. Most of our practitioners are in the Portland to Eugene I-5 corridor hub, but our state is roughly 100 million square mile or 100,000 square miles. So it's hard to get those rural people from other parts of the state there. And part of that was due to limited funding of our organization. So we wanted to use our grant in order to be able to fund a summit that we could get everyone at and focused on. So once we were able to get our grant successfully accepted by ASHP and knew that we had the funds to create this summit, we went about planning for our workshop. And a few of the things we kicked around were, should this be open to everyone or invite only? And we actually ended up going with the invite only route. And we used that invite only method as a way to help boost our completion rates of our self-assessments. So the only way that people were invited was if their institution completed a self-assessment prior to the invite deadline. And so that helped us get a much better background and baseline to figure out where we were at with our practices in Oregon going into the summit. But again, in order to make sure we were covering all our bases, we wanted to make sure that we had people from our technician chapter, our schools of pharmacy. We actually invited a couple members of our board of pharmacy to come and participate in the summit with us. And then the other big thing that we were kicking around was a standalone conference or associated with one of our annual meetings. And we ended up deciding to do it as a half-day event prior to the start of our normal spring conference, which is our big conference in Oregon. That way, people were already getting together in that location, and it helped kind of assure we would have adequate numbers to do this. This is just an example, or this is what our workshop agenda looked like. I won't spend much time on it. We can skip to the next slide, but if you're interested in how we set the workshop up from a breakdown standpoint. So we had some local success stories, including what people were doing with a technician checking validation program. That's what it's legally defined as in Oregon, which is our tech, as well as using techs for med-rec, billing for pharmacy services in the ambulatory setting, use of pharmacists in pain management, and what a few institutions were doing with credentialing and privileging. So we had these pearls to kind of get everyone excited about what's already happening in Oregon and how do we expand upon that. But the heart of our summit was our action planning and getting a consensus developed for what our action plan moving forward should be. So we had facilitator-led groups, and using the results from our self-assessment surveys, we looked at, here's the major areas that we seem to be ahead of the game in, and here's the areas where we're falling behind, and we had each group discuss those areas and pick out various top priorities for their tables. I think we had groups of roughly 8 to 10 people, and there were about 14 tables total then. And they all gave us a list of what they thought were areas that we should focus on working on in the future. After we had those lists, we actually narrowed it down to our top 2 priorities by giving everyone a vote. Everyone had up to 3 votes, and then using the total voting, we figured out what our top 2. You can see the pictures there. We were using just little sticker dots on the white papers where we were consolidating all our ideas. So that was a nice, easy method for visual representation of these are the things our members are interested in and want to focus on. So the top 2 priorities we came up were advancing the role of pharmacy technicians. Some of the sub-points of that were that we needed to develop more competencies and standardize work, because the technicians were doing different degrees of work all over the place. We also wanted to work on what our retention strategies are. We tend to lose a lot of good technicians moving on to other careers. And we wanted to be able to provide a unified voice for guiding regulations around what technicians can and can't do in Oregon. And then our other big one was credentialing and privileging, which I think everyone is interested in. So in Oregon, we were sort of lacking a formal process, and we needed to expand what the scope of practice of a pharmacist was. We wanted to develop some toolkits and guidance documents for people as they would begin implementing these in their institutions, and then draft some policy statements for our organization saying why we support these efforts and what we would like to see being done in Oregon. From that, we actually then moved into last fall setting up a technician summit similar to the PAI summit we held. Because at the PAI summit, we only had about 2 to 3 technicians, so we wanted to get more technicians' voice on how we're actually going to move them forward. At the technician summit, we were able to get about 20 technicians together, which if you look at our association, that's almost all of our actual technician members. And we ran a very similar format to the PAI, and out of that became our top priorities were decided on that we need more resource development, guidance documents, toolkits for technicians and organizations to use for when they are starting to implement these advanced technician work or trainings and responsibilities, as well as we need some more organization around advanced training and certification. So similar to what we heard earlier about Wisconsin's toolkit and implementing tech check, that's the kind of thing that Oregon needs currently for more institutions to be able to roll these out. Is how do you implement it, and how do you determine whether people are actually appropriately certified to do that workload? And then we wanted to create more around our standardized education out of our technician schools and provide some career ladder opportunities for better retention. So similar things to what we had kind of come up with our PAI. On the credentialing and privileging side, we've met a couple times with our task force. We reconvene that original task force to help look into what our next steps are here. We actually decided to approach this from a professional side more so than the legislative side, because Oregon, we're in one of the unique positions of that pharmacists were already recognized as providers in Oregon. That was a recent development a couple of years ago with our legislation. And just most recently, this legislative session, we actually developed a pharmacist formulary where there'll just be, the Oregon Health Association will have sort of just essentially a list of drug classes that pharmacists will be able to prescribe. That obviously still has a lot of work to go to make that happen, but at least now legislatively it's in place. So we didn't think there was a lot on the legislative side we needed. It was more from the professional side of keeping things moving forward. So we did end up draft a policy statement that was approved by our board to support credentialing and privileging in Oregon. And currently we're working on developing some additional resources with other policy statements and guidance documents and toolkits. And then a few of our continued challenges that we've been running into since we had our PAI Summit and the Tech Summit is just sustaining that momentum. Everyone walks out the door of the summits pumped up and jazzed about, you know, let's make this happen and let's push pharmacy forward. But once you get back into your daily work, it's hard to keep reconvening everyone, especially with the geographic diversity we have. So we've been doing most everything virtually, which helps a little bit, but trying to get everyone organized for meetings is difficult, obviously. Then the professional versus legislative implications. So one of the issues we also have from the legislative side is while our Board of Pharmacy does support advancing pharmacy practices, they don't want to necessarily be involved in the regulation of that and would like to see the regulation of credentialing and privileging fall upon either OSHP or the institutions themselves specifically in terms of having standard methods for how somebody is credentialed and privileged and what those requirements are. Hence why we need to be developing these toolkits. And then the other problem was looking at this just from a health system standpoint or a profession as a whole. So in order to not leave out our community colleagues, we're in the process of developing a joint task force with our APHA affiliate. We want to make sure that we're speaking, when we do speak to things, we're speaking about pharmacy as a whole. And so now I'd like to hand it over to Denise.
Thanks, Robert. Good afternoon to you all from Indiana, where sometimes the weather can be a bit unpredictable. So today I'm grateful for sunshine and no rain. So first I'd like to share with you the mission and vision statement for our State Pharmacy Association, the Indiana Pharmacists Alliance. So as you can see, practice advancement it currently tops our list of missions and objectives here as we work to advance Indiana provider legislation, pharmacy practice provider legislation and service reimbursement. So we also have a little bit of a different state structure than the one described earlier by our colleagues in Ohio and Oregon. So if we can go to the next slide. Our State Pharmacy Association is actually what we call an umbrella structure. So we're a unified organization that encompasses all practice settings from within the state, and then we have an academy structure breakout to give a home for each practice setting. So we have our Health System Academy, which is the affiliate for ASHP, our Community Academy, which is the affiliate for APHA, and then we have the Specialized Academy. In case you're wondering, the Specialized Pharmacist Academy was created to provide a home for non-traditional pharmacists practicing within our state. So whether that be managed care, industry, regulatory, veterinary pharmacy, whatever that might be. And also a little bit different would be our technician and student pharmacist members now belong to the academy of their practice setting with the pharmacists rather than having separate academies as we had in the past. You can also see that we have councils, and you'll notice I've highlighted the legislative and regulatory task force. This is the former Practice Advancement Task Force that our state affiliate academy had created, has now transitioned into a task force for practice advancement that represents all practice settings for our entire state association. And I'll discuss this a little later in my slide. So we first created our Indiana Pharmacy Practice Model Task Force in 2012. John Hertig served as the chair from 2012 to 2013, and then I took over as chair from 2014 to 15. We had 13 members representing various, I think, voices within pharmacy, within health system pharmacy in our state. We had representation from academia, large and small health systems, including a critical access hospital, from inpatient and ambulatory care pharmacists, from seasoned pharmacists and new practitioners. And I think it was important to have all those different voices at the table on our task force. The first phase of what we really focused on was our efforts were employed to do outreach to ensure health systems and pharmacy leaders within our state were aware of the practice advancement efforts from ASHP, and to also engage them and encourage them to complete the hospital self-assessment for each of their facilities. I've highlighted a couple of non-pharmacist groups that we engaged early on to help with our outreach efforts, in addition to our telephone call and email efforts from our task force members. We asked a wholesale vendor client representative, so Cardinal Health is pretty well known in Indiana, covers a lot of the state, and then you have Mercersburg. So we looked at those larger wholesale vendors, and there's just one or two reps that covered the state. So we reached out to them and asked them if they'd be willing to send an email on behalf of our group to their clients, as that they may have more reliable contact information, and their email might not go to spam like we feared they might if we were sending them from our personal Gmail accounts. We also engaged the assistance of the Indiana Rural Health Association, who had an established pharmacy roundtable group with representatives from the hospital pharmacist members. So there were more than 20 critical access hospitals represented at that pharmacy roundtable. Instead of reaching out to them individually and the time and effort that would take, I just went to one of their roundtable meetings to present these efforts and ask them, and I'm happy to say that our rural health representatives in Indiana, probably within 2 months, all that were at the meeting had completed the self-assessment. So as we began to see some movement in the percentage of facilities that completed the assessment, we moved on to phase 2, which was to try to dissect the opportunities for learning and focus. We looked for best practice facilities, we looked for trends across the state, or maybe we were further away from best practices in all the settings. What was our low-hanging fruit in Indiana? We enlisted the help of some rotation pharmacy students to dissect the data into groups, such as how do our small hospitals perform versus our large hospitals, so that we could identify best practices that might possibly be more challenging for some of the smaller facilities. We later used this data in presentations. For instance, at the Indiana Rural Health Association's annual conference, we discussed practice advancement for pharmacists specific to small rural facilities. And that conference isn't just attended by pharmacists and nurses, but also it's largely attended by the CEOs of those critical access hospitals in Indiana. So we were identifying opportunities, but we were a group of 13. We really needed some support to continue the momentum, because we all had busy schedules, like I'm sure many of you that are on the call today have. So next slide. So the foundation grant that we received in February of 2013, and we held our workshop or summit in May of 2013. This really brought about the momentum or boost that we needed. We brought in a larger group of hospital pharmacists and pharmacy leaders from across the state to review the data that we had collected up to that point in time on the hospital self-assessment for our state, for all the facilities that had participated. So what we ended up doing is establishing consensus opportunities, and then as a group we prioritized what are our top priorities for our group. This really did help to develop a state affiliate strategic plan for advancing practice within Indiana. So then we moved on. So phase 3, we took those top 3, and I guess if you can go back, yeah, right there, phase 3. It was initiated with the task force serving as really the steering group that was responsible for follow-through on the priorities identified. So our top 3 priorities identified were pharmacist involvement in transition roles, pharmacy technician advancement, and then reimbursement for pharmacists. So next slide. We used an action plan to track our goals and our actions, as well as identified responsible individuals from the task force for each of our top priorities. So we did some of the things we ended up doing early on. We did presentations at the State Pharmacy Association meeting and at other meetings for other groups like the Indiana Rural Health Association on these topics. A couple of the presentations we did unique technician roles at our State Pharmacy Association conference, which was interesting for a lot of us to learn different ways to use technicians in our hospitals and health systems. But we also did one at the Indiana Rural Health Association for the CEOs and CFOs in the room on pharmacist billing for wellness visits. We also pursued legislation to advance our technicians within Indiana. So the new pharmacy law, this new pharmacy law that's highlighted here, made some changes to technician training requirements and eligibility requirements and was signed into law in 2014. We learned a few things in this legislative pursuit, and we've really matured our efforts over the past 3 years. We previously had a pharmacist that was very engaged in working with our legislators prior to the task force, but she was an N of 1, so we added her to our task force, and this provided a larger group of folks to help the legislative efforts that she had already started. We've learned that multiple modalities are really needed to reach members and key stakeholders. This is at utmost importance. You can't rely just on letters and emails and telephone calls alone. Social media is something we now use, and we've invested in a new website for our state association to provide more virtual networking opportunities. We don't have a platform like ASHP's Connect currently, so this new website will provide that electronic networking and advocacy effort platform that we so need. We've also learned that you can't approach legislative and practice advancement within our state just from the lens and interest of the health system pharmacist. We have to engage our colleagues from other practice settings. When we first presented our technician bill in early 2014 to our IPA board, we got some pushback from our community pharmacist counterparts. So we've learned to develop the language and focus with inputs from pharmacists in a variety of settings before attempting to gain that support from legislators and key stakeholders within Indiana. Some of our most established constituents and seasoned advocacy experts are actually our independent pharmacy owners within our state. Many of them are involved at the local government level, maybe even hold a local government position, as well as they're just experts in advocating for legislative change for their communities and for their practice setting. We've also learned that practice advancement can't just be about the lens of our profession and advancing our profession. We have to desire to advance practice to fill a need that exists within our state. So our 2016-2017 legislative year efforts were built around developing a relationship with various stakeholders from across our state to identify the top population health needs, which have been obesity, smoking, and infant mortality for the past several years. We then built that into our practice advancement legislative efforts. We built that around those needs. So we really focus on immunizations and tobacco cessation for our 2016-2017 legislative efforts. So the next few slides, just a point of interest, you can see on this first one, we really only had 2 to 3 pharmacy-related bills passed every 10 years in Indiana from 1990 to 2010. So in 2010, we had 2 pharmacists elected to our state legislature. One was in the House of Representatives and one was in the Senate. And you can see in 2011, and if you go to the next slide, 12 and 13, this provided a little bit of a boost because now we went to like 1 bill a year. But you can see our summit did play a part in boosting our legislative and advocacy efforts with 2 bills per year passed in 2014 and 2016. And as I said, our efforts and structure have matured over the past few years, and we now work in a year-long process to advocate, and this is really paid off. So the next slide shows a lot of our year-long structure of how we now work in the legislative process. But then if you go on to the next slide, so in comparison to the 1990 to 2013, in 2017, we had 7 bills. It basically built within this 1 bill, House Bill 1540. And then if you go on, next slide, and then next slide, I think. And then besides that 1 bill that had 7 bills, we had 3 other bills as well. And you can just breeze through those. Next slide, next slide, next slide. So I think that, we really made some progress in our efforts. And I'm going to pass things over now to Kathy Baldwin from Florida.
Thank you so much, Denise. I am going to round this out by sharing with you some caveats for success. My name is Kathy Baldwin, and I am the president of the Florida Society of Health System Pharmacists. My team consisted of Chair, Dr. Hoda Masmoe, a Vice Chair, Dr. Adrian DeBerry. Dr. Masmoe is an ambulatory care administrator, pharmacist, and Dr. DeBerry is an ambulatory care practitioner, clinician pharmacist. And special thanks to Tamika Bennett and Brooke Farrell from our society. And next slide, please. So in the state of Florida, and I have to tell you that we are the last state to allow nurse practitioners to be able to write a 7-day supply of opiates in an acute setting, despite being one of the top 4 states with the opiate epidemic. So we work very hard here. Things do not come to us easily. And when we got this grant, we found ourselves in a conundrum. And that conundrum was this: who are the ambulatory care providers within our state? We do not have the expanded roles and scope of practice that some of the other states who spoke today have. And I say we do not have it yet. It is forthcoming. So how do we identify who these practitioners are, and how do we optimize our interactions with them? That was our biggest challenge here in Florida. We also realized from the get-go that we need to incorporate into our invitation a link for those RSVP people who are coming to take the survey. So as you RSVP for our workshop, which is going to be held in 3 weeks at our annual meeting, we built the RSVP to include the survey link. If you'd give me the next slide, please. So this is how we advertised it, and we thought, we know that the VA hospital will have ambulatory care providers. We know that the academic settings will have ambulatory care providers. But what we didn't know are that there are a lot of community health centers who also have ambulatory care providers. So we decided, unlike some of the other groups, to open this to anyone within the state who practices ambulatory care pharmacy. So this was a copy of our invite, cut and pasted for you here. Free workshop. You can have 3 hours of CE. And please, if you want to come, do 2 things. One is take the survey and then RSVP here to attend the workshop. Now, this worked out very well because 49 out of the 60 RSVPs took the survey. So we now have the survey results, which interestingly enough were exactly what the other states found. We found that the topics for our upcoming workshop include billing, the use of technology, the optimization of technician roles, and credentialing to be our top 4. So I will talk now more about how we identified our target audience. As I told you, and you can go to the next slide, please. As I told you, we had 60 RSVPs. Out of those, 20 or 1/3 are not current FSHP members. It kind of made us realize that there's a need out here, and we were unaware of that need. So just by planning this workshop, we began to see that there's a target audience that we typically are not going after. So one of the ways that we found AmCare providers within our state was to go to the Board of Pharmacy Specialties, and there they have, you can pick a location, and you can pick, the state of Florida, and it will list for you ambulatory care practitioners within your state. So that provided us some of our target audience. Next slide, please. Again, we talked about knowing that ambulatory care is happening in the universities. So we went to the universities, and we also asked our universities, and we have 7 of them now in Florida, to please either provide us a list of their ambulatory care preceptors, or if there's some confidentiality issues, to forward our invite to their preceptors. And we did that both ways at different schools of pharmacy. Next slide, please. So when we realized, you know, we live in a pretty big state as well, geographically, and we always have our annual meeting in Orlando because it's smack dab in the center. Only more center is the swamp, so we don't want to have it there. So we invited people in the Orlando area to come to this conference. So while we did extend an invitation to the VAs in Palm Beach and in Tampa, we recognize that it's a 3-hour workshop on a Friday afternoon, and the VA pharmacists we really wanted to target were those who could put a full day's worth of work in, drive across town, come to our workshop, and actually contribute because they're currently doing these expanded roles. Next slide, please. Now, there are other sources that we use to identify our target audience, and one of them are federally funded clinics. So at this website listed for you here, we are able to put in the Florida, and actually Orlando, Florida, and we came up with many clinics for indigent patients that we didn't even know existed. And we were able to find those clinics, go on LinkedIn, and search for the name of that clinic and pharmacist, and found some of our attendees that way. I was actually able to have LinkedIn conversations saying, I see you're an ambulatory care pharmacist at this clinic in Orlando. Would you like to come to our 3-hour workshop? And as a consequence of that, had many conversations with pharmacists in Orlando I had never even thought of or met before. So I'm kind of looking forward to meeting them. My first question to everyone in the group is, how did you come to know about this webinar? And LinkedIn was very instrumental in that. Next slide, please. So we also did Twitter and Facebook, but by far LinkedIn was our go-to target audience. Next slide, please. So we did do emails. My age group tends to like emails, so we emailed our director of pharmacy members, our entire membership, and called people from past membership from ambulatory care settings. Next slide, please. Okay, so I will give this back to you, Beverly, and thank you for your attention.
Well, thank you very much to all 5 of our presenters for some excellent points. Audience, you will note that each of these states did something just a little bit different in the arena of inpatient and ambulatory care. That's the nice part about getting involved in PAI, is you can focus it for the needs in your state. I am going to ask, we have just a few minutes left, I'm going to ask each of the presenters to just off the cuff react to 2 questions. The first question for each of you is, what one piece of advice would you provide to our audience on applying for a foundation grant?
Hey, this is Jackie. I can start. I guess my gut reaction is just do it. It's really not a difficult process. It does require a little bit of time and effort, but if you have the support from your organization and have an idea that you need funding for, it really is a pretty straightforward process.
This is Kathy from Florida. I think I would say seek and listen to the experts. ASHP has provided us 2 wonderful experts who will be coming to speak at our workshop in 3 weeks. And they had already done this workshop in several other states. So having them as part of our planning committee was very helpful in getting our grant underway.
This is Denise. I would say make use of that Practice Advancement Initiative page on the ASHP website. There's so many resources, toolkits, one-page graphics that you could draw from. Utilize the resources that ASHP has developed to help you as you think about applying.
And then the second question is, how did your state affiliate use the assessment results from either the inpatient or the ambulatory to improve your organization's education, advocacy, planning, member outreach, etc.?
I can take a stab at that first. This is Robert from Oregon. So we use the self-assessment in order as a basis for our summit planning. Similarly to what we heard on a few of the speakers, was that we went through, and after getting the self-assessments from all our hospitals, we kind of divided out each piece into various areas of technology, technician use, MedRec, those kinds of things, and really looked at where do we seem to excel and where do we fall behind, and use those where do we fall behind points as, all right, people, we're looking at these are the areas that we're not doing as well in. Why is that, and what can we do, and how can we focus our efforts on these areas to keep moving forward?
So this is Denise. I would also, one of my suggestions would be, don't just consider education for your pharmacists, also consider education for your health system CEOs, CFOs, CNOs. Help them to better understand with good practical success stories from your state, from other health systems, especially for those rural critical access facilities, how a pharmacist can do something like wellness visits, how a technician can work in a way out, other than what you traditionally think. So I think getting outside of the pharmacy silo, because we can preach to the choir all day long, but if we really want to see movement, we've got to get outside of our box.
This is Kathy from Florida. I think one of the things that it showed us is that there's an entire target audience out there that we're not really getting. We were at a loss to identify who these people were, and once we identified them, they came. It's kind of like if you build it, they will come. And I think that we're going to have more ambulatory care workshops or offerings or networking, and take this to a whole new level for FSHP. And I want to thank you all. We're trying to be honorific of your time, if you will. We have about 2 minutes left. To sort of close up, I want to thank all of you for sharing an hour of your time with us this afternoon. This webinar has been recorded. We will be pushing out the link within the next 24 hours or so to each of the participants. Please absolutely feel free to share it with your board, leaders in your organization, various consortia you belong with, anything of that nature. The slides will also be available if you'd like to use portions of them, and we'll include the link to the Foundation Grant Survey and the PAI overview page. A couple of upcoming webinars that are on tap. We've laid out the webinars for the rest of the year. In mid-August to early September, we'll be doing a webinar on attracting small and rural practitioners to your organization and how to meet their needs. Also in August and September, we'll be doing a recorded webinar on selecting an association management system to enhance your website and member services. In October, we'll be doing a webinar on enhancing your membership marketing plans to recruit and retain members. And then the last webinar of the year will be in November, and it will be on the overview and impact of the Pharmacy Technician Consensus Conference and its potential impact at the state level. Thank you so much for joining us, and we hope you have a lovely afternoon.